Good day friends, I'm Dr. A.S.K. Gupta and I'm going to present to you a case of meningocoel in the coccygeal region of a primary patient who has come to us for the routine second trimester ultrasound. You can see that this is the femur bone and there is a cystic swelling at just the level of sacrococcyx. Left side there is a cystic swelling. This is nothing but the meningocoel, which is more towards the left hand side, and though it is in midline in the coccygeal region, but more towards the left hand side, and you will see it again that it appears more on the left hand side. Trying to see it in the longitudinal view, this is the longitudinal view of the spine, and here you see that there is a hypodensity, hypoechogenicity, and this hypoechogenicity is nothing but meningocoel of the sacrococcygeal region. There is a spinal bifida defect in the sacrococcygeal region. Let us try to see the rest of the spine. This is the spine, this is cervical region. Trying to follow it down below, the spine appears to be normal. In the thoracic region, the spine appears to be normal. And let us try to go down. We are trying to go down below into the lumbar region, and we find that the spine over here in the lumbar region also appears to be normal, but suddenly we find that there is cystic swelling in the lower part of the coccyx and the sacral region, which is nothing but the meningocoel. And how do we differentiate whether it is a meningocoel or it is just meningomyelocele? Meningomyelocele will have the component of the nerve sheaths and the nerves and the spinal cord, but this is largely a clear cystic swelling, so it is most likely to be the meningocoel. And the size of the meningocoel, as you can see, is 3 centimeters by 2.75 centimeters into 3 centimeters, which is not a very big but not a very small swelling, and it should not be missed. Whenever we see the meningocoel or meningomyelocele, it is always imperative that you should see for the active movement of the limbs. Because the meningocoel or the meningomyelocele of the sacrococcygeal region are likely to affect the lower limbs, it is imperative that we should look for the active movement of the lower limbs, and that's what we are trying to see over here. These are the limbs, lower limbs, but are they moving with the normally with the time they should move, and there should be an active movement. You can see that there is active movement of the lower limbs over here. These are the lower limbs which are actively moving, and this is the upper limb over here, this is the upper limb over here, and all 4 limbs are mobile. Whenever you come across any congenital anomalies, it is important to look for the associated congenital anomalies. The heart over here appears to be normal. This is the posterior fossa, and you can see that the cisterna magna is normal. This is the cerebellum, which appears to be normal. This is the nuchal fold thickness also appears to be normal. There is no banana sign, and it appears that there is no leakage of the CSF. So the AFI in this patient was found to be normal. The meningocoel, as you see, in the sacrococcygeal region, and because the meningocoels of the sacrococcygeal region may be associated with the annular carry malformation, so it is imperative that we should look for the hydrocephalus. There is no evidence of hydrocephalus, and the little ventricle appears to be 1 millimeters in size, which is normal. This is the rest of the baby in quick motion, and you find that the skull and the upper lip and the lower limbs, they appear to be normal. Lower limbs are showing the active fetal movement. The 3 vessel cord, which is normal, and the origin of the cord from the abdomen is also normal, and the cord is attached normally to this to the placenta, which appears to be normal. Meningocoels are basically the defect in the spine through which the meninges they start protruding into the skin and form a cystic swelling, and in case the nerve roots and the spinal cords also starts protruding along with the meninges, then it is called as a meningomyelocele, and in case only the meninges they are protruding, then it is called as a meningocoel. It has to be differentiated from the pseudomeningocele, which might appear as a cystic collection, but it does not have any meninges, and there is no spina bifida defect in these patients. But the patients in the meningomyelocele or the meningocoel will have a associated spina bifida defect. So this is a case of isolated meningocoel of the sacrococcygeal region. I hope you like our video. In case you like it, please do not forget to press the like button. Subscribe to our channel and share the video among large number of friends so that maximum number of people can be benefited. Thank you very much.